And right now, healthcare professionals are working around the clock to try to get the outbreak under control as thousands across the globe are now quarantined.
And Arizona Representative Paul Gosar is in self-quarantine. He joins us live on the phone this morning. Representative, thank you for joining us. First of all, before we talk about how you came in contact with this, are you feeling any symptoms? You doing okay?
We're doing okay, Scott. There were myself and three of my staff members that had spent some time with this individual, but we just finished our 9th day and we're showing no signs. So taking good care of yourself, eating and sleeping well actually helps you out.
Right, you're right about that. How did you come in? I mean, how did you even know that you needed to be checked out?
We were actually contacted by Kevin McCarthy, the minority leader from the Republican side, and then the team or the congressional physician. And then we were in contact with Dr. Fauci, that's the head of CDC's infectious diseases. They told us that the individual that we had come in contact had gotten very sick, and that they had spent quite a bit of time with us, and so wanted to make sure that we knew and find out how we were feeling. And we were, like I said, we're doing fine. The chances of us getting this problem now at this late stage is less than 5%, but they just wanted to make sure that we followed through for the quarantine of 14 days.
At that point, were you already in Arizona? Is that when you quarantined, or were you in D.C. and then came back home?
No, we found out yesterday early morning, and we were here in Arizona. So from that standpoint, that's when we found out. But it also shows you that if you take good care of yourself, common sense, don't touch your face, wash your hands, eat well, sleep well, and if you're particularly one of the groups that you have underlying health problems like diabetes, high blood pressure, cancer, you should stay out of the public limelight. Other than that, just good habits help you out.
What about people that have been in contact with you since this on a plane or anywhere near you? Should they be concerned? Do they need to go get checked out?
No, because what ends up happening is that you're much more susceptible to get this in the 2 to 5 day incubation period, and after that it drops off quite fast. There were others that were close to this individual as well. They got sick, but the four of us, and for my staff, we're all doing very well. We're just making sure that we follow the protocol. And they just advised us, just probably don't travel back, but, just common sense.
Congressman, can I ask you about a tweet that you sent out a couple weeks ago on your personal account, kind of mocking the coronavirus and the irony of now you quarantined?
Well, the thing about it is that what we're looking at is the hysteria with this. And from the standpoint is this is an opportunity to set the record. I'm a healthcare provider. We take universal precautions, and what we start to see is people making political hay out of a situation that we all ought to be working together with. And so when you look at what the other side has been doing, and some of the media, we're hyping this to a point where hysteria takes over. And one of the things we ought to be doing is common sense, working all together, putting America first. And from that standpoint, I think the rest is the way to go.
Yeah, we don't want any hysteria, and we stress every single day the important thing is to wash your hands, wash your hands. Do you think that Washington is doing enough right now for this?
Well, it's an evolving situation, Scott. So, at first, having the delay, the president having the delay of travel, actually gave us a good head start. But China's not been forthright. The CDC is now involved. It takes some time to get the DNA subscript so that you can start building a vaccine. So you're taking care of peripheral type of problems, like flu-like symptoms. So from that standpoint, they got the resources. It's the CDC. There's no one better, And so from that standpoint, I think they've done everything they can, and now it's up to us. We shouldn't be wanting to be victims. We should be self-empowered. That means, once again, stressing good hygiene. Wash your hands. Don't touch your face. Stay out of crowded places that are congested if you're somebody that's elderly or has underlying health problems like cardiac disease, diabetes, cancer. And take care of yourself. Get some fresh air. Stay away from those congested places. And for God's sakes, don't travel. Arizona is a great place to stay here right now. It's got beautiful weather. Enjoy it. Stay home and enjoy.
Well, listen, we appreciate your time. We hope you stay healthy. It sounds like you're going to, and we'll catch you soon.
Sounds good. Thanks, Scott.